Good afternoon, everyone. We will get started in just one moment. Wonderful. And I can add you in when I get the request to join. Today's live is very special because it will not just be me, we'll be with the lovely Jewel. Whitman-Walker page, here she is.
Hi, Ellen.
Hi, love. Good afternoon.
How are you?
Wonderful. And yourself?
I'm good. I'm good. Happy Wednesday, Woman Wednesday.
Wednesday. Oh, I love that. Beautiful, beautiful. And so, just to get us started with our intro, before we introduce ourselves, during the COVID-19 pandemic, the Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So again, good afternoon. My name is Ayele Ba. My pronouns are she, her, hers, and I am the Community Health Education and Training Director here. Let me remind myself, and Training Coordinator here at Whitman-Walker Health. And I'm very happy to be here with the lovely Jewel.
Thank you. I'm like speaking into existence.
Come on.
My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Team. And today we're going to discuss Breast Cancer Awareness Month. Ayele, before we begin, what are some of the ways in which you practice breast and chest health?
Wonderful. Thank you for asking. So one way that I practice breast health is by trying to live a healthy, balanced lifestyle generally, because a nutritious, low-fat diet with plenty of fruits and especially green and orange vegetables can help reduce the risk of developing breast cancer. On the contrary, a high-fat diet increases the risk because the fat triggers estrogen production, which can fuel tumor growth. Also, exercise helps to boost the immune system, and as little as 3 hours a week can help to reduce my risk of having breast cancer in the future. So those are two things that I would like to, that I think that I'm including, that aren't necessarily breast directed, but help to address that.
But still, they have a powerful impact on helping lower your risk of developing breast cancer. So thanks for sharing those. I think on my end, I think I went for like my women's health appointment last year and learned that I had very dense breast tissue. So it's going to be harder for me to do self-exams at home and really detect anything on my own. So I think from that, I've learned that I should probably go and get checked, by a professional however often it's recommended for my age and based on my breast cancer history in my family and whatnot. But that's one way that I try to take care of my breast health.
Wonderful. Thank you for sharing. And that question is really great to get us started with the topic of today, the history of Breast Cancer Awareness Month, or October, that we get to celebrate internationally during the month of October. It is to increase global awareness about breast cancer in the United States and internationally, known as Breast Cancer Awareness Month. It was first organized as a week in 1985. And it was founded by the American Cancer Society. And oftentimes, things regarding Breast Cancer Awareness Month can be recognized by the letter pink. The color pink. But do you want to talk a little bit more about Breast Cancer Awareness Month today?
Yeah, so today, campaigns to increase awareness around breast cancer and to educate people about methods of prevention and early detection, and to raise money and support research have reached other parts of the world. So it's not just here in the US that we're recognizing Breast Cancer Awareness Month or educating ourselves about it. Now we see nonprofit organizations like Whitman-Walker and other government agencies and medical societies who work together to promote breast cancer awareness and how to keep yourself healthy and safe. We also use this time to remind people about breast and chest health and the symptoms to look out for. So let's start with the working definition. Breast or chest cancer starts when cells in the breast or the chest begin to grow out of control and form tumors. Tumors can be benign or cancerous, also known as malignant or invasive, and if they invade your surrounding tissue or organs or spread, also known as metastasize, to other areas of your body, it's often diagnosed by an ultrasound or a mammogram, and people who identify as men or genders other than women can develop breast or chest cancer too, but it's much rarer. But it's not just a thing that you get because you are a woman or identify as a woman.
And there are many symptoms to look out for as well, because many types of breast cancer can cause tumors in the breast or chest, but not all do. Other symptoms to look out for would be breast or nipple pain, nipple discharge, nipple retraction, redness, scaliness, or thinning of the nipple or breast skin, skin irritation, dimpling, when it looks almost like a orange skin, or swelling on or all parts of the breast or chest. And there is one way to look out for these symptoms, and that is in the breast or chest self-exam. And that is regularly examining your chest on your own, and it can be an important way to find or detect breast cancer early. When it's more likely to be treated successfully, and when found early, it's more likely to be treated successfully. While there is no test that can detect all breast cancers, breastcancer.org believes that performing this breast self-exam in combination with other screening methods can increase the odds of that early detection. For menstruating people, the best time to do a monthly breast exam is about 3 to 5 days after your period starts. Do it at the same time every month, as your breasts are not as tender or lumpy at this time in your cycle. If you are not menstruating, doing the exam on the same time every month can be helpful to know your body at each time. You can start by looking at your breasts in the mirror with your shoulders straight and your arms on your hips. And you want to look to see that your breasts are their usual size, shape, and color. Breasts that are evenly shaped without visible distortion or swelling. And if you see any of the following changes, bring them to your doctor's attention. So dimpling, as we discussed earlier, puckering or bulging of the skin, and a nipple that has changed position or inverted, meaning pushed inward instead of sticking out, and any sort of redness, soreness, rash, or swelling. Next, so starting with your hands on your waist. Next is to raise your arms and look for those same changes. And then, and it's helpful to do this in the mirror where you can really see. But while you're in the mirror, look for any signs of fluid coming out of your nipples as well. That could be watery, milky, yellow, or blood. Jewel, I think you're muted.
Oh, yes, I was. My
Okay.
bad. So next, you want to feel your breast while you're lying down. You can use your right hand to feel your left breast, and then use your left hand to feel your right breast. You want to use a firm and smooth touch with the first few finger pads of your hand, so like these, or even 3 of them, and keep the fingers flat and together. You want to use a circular motion about the size of a quarter as you kind of move around and feel for any lumps or bumps or knots. You want to cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage, and follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. And you can also move your fingers up and down in vertical rows as if you were mowing a lawn. This up and down approach seems to work best for most people, but you want to be sure to feel that all the tissue from the front to the back of your breast. For the skin and tissue just beneath, use light pressure, and use medium pressure for tissue in the middle of your breast. You want to use firm pressure for the deep tissue in the back. When you've reached the deep tissue, you should be able to feel down to your ribcage. Finally, you want to feel your breast while you're standing or you're sitting. Many women find that the easiest way to feel your breasts is when their skin is wet and slippery, so they like to do it this step in the shower, but make sure that you cover your entire breast using the same hand movements that we described in the previous step. Ayele, what's one thing that you're going to be leaving the space with today and applying to your breast and chest healthcare routine moving forward?
Well, I definitely have been skipping out on these monthly self exams, so I'm going to start making that a part of my self care routine, and also remind my breasted and chested friends and loved ones to do the same too, because those are some really great tips that you provided. So thank you so much.
Thank you. And agreed. I think I've got to leave the space and let my friends know that if they haven't already done their self exam for the month, now's a great time to do it because it's Breast Cancer Awareness Month. And I will also get better about doing my monthly exams. I've been so horrible about it, and I think I finally have gotten to like the age bracket where I need to be doing them more regularly. So I'm going to commit to that in this space right now.
Wonderful, wonderful, wonderful. Well, thank you so much for doing the slide today, where we could talk a little bit more about Breast Cancer Awareness Month. And before we go as well, I just wanted to share a few reminders about the HIV and STI prevention and testing services available through Whitman-Walker. Before we go in, I saw a comment in the section in the comment saying monthly. Yes, it is suggested to do monthly. And if you are a menstruating person, around the same time of your cycle each month, recommended 3 to 5 days after the beginning of your period if you are menstruating. Yes. So again, before we go, I want to share a few reminders about the HIV and STI prevention and testing services available through Whitman-Walker, and learn about Whitman-Walker's testing hours and locations at whitman-walker.org/testing. And okay, sorry, I'm gonna pause again. Is there always a lump? Oftentimes our breast can be naturally lumpy, or can have different types of feelings, but it was more important is to look at what's different from your normal. So that's why it's important to do it monthly, is so that you can notice any differences from your normal. So if you're like one thing was soft one month and the next month is hard, or something that felt like a lump feels bigger the next month, those would be things that you would want to see your doctor on as soon as possible. And if you don't have a cycle, doing it at this around the same time each month can be helpful.
Those are great questions, community health
Yeah.
professional. Thanks so much.
Thank you so very much. Yeah. And so back to our about our testing. And again, if there are any questions, please feel free to put them in the comments or reach out to us, and we can try to get you information. Thank you so much for joining us today. So again, HIV and STI testing is available by appointment at Whitman-Walker Health. Look at both locations. Call 202-797-4439 to schedule a testing appointment. And be sure to check out our website for the most up-to-date hours. The locations are at the Max Robinson Center, 2301 Martin Luther King Jr. Avenue, Southeast in Anacostia, and Whitman-Walker Health at 1525 14th Street Northwest in Logan Circle. If your community organization is interested in the Whitman-Walker providing mobile health services in your neighborhood, contact mobilehealth@whitmanwalker.org. Access HIV prevention tools like PrEP and PEP, or start treatment for HIV with Whitman-Walker Health at the Max Robinson Center or at our 1525 location.
Mm-hmm. Thanks for sharing that information. I hope folks are getting their, if they haven't already done so, for their 6-month period, getting tested. It's great to get tested at least twice a year, if you're sexually active. But finally, please save the date for Whitman-Walker's 36th annual Walk to End HIV on Saturday, October 22nd. You can register to walk or donate at walktoendhiv.org. And this year's walk will actually take place at Whitman-Walker's new medical home on the campus of St. Elizabeth's in Congress Heights. So this is probably the first year ever, maybe, or one of the very few years that it's not on Freedom Plaza. So definitely want to check that out. And also on October 26th, in recognition of Breast Cancer and Awareness Month and just breast and chest health awareness, you can join the community health team for an event at Crazy Aunt Helen's from 5:30 to 7 p.m. And you can RSVP to RCATA at whitman-walker.org. Again, that's RKEITA at whitman-walker.org. And all month long, if you go to Crazy Aunt Helen's, you can order a Booby Blossom cocktail and they will give $1 of every drink sold to Whitman-Walker's Women's Health Department. So definitely want to support in that way. But thank you all for taking the time to learn a little bit about Breast Cancer Awareness Month, where to get tested, how to prevent HIV, and how to help support the fight against HIV. We appreciate you. But before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step toward preventing yourself and your loved ones and your communities from getting sick. Multiple variants have spread across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine isn't 100% effective at preventing new cases of COVID-19. But we know that it's very effective at preventing hospitalizations related to COVID, preventing death related to COVID, and preventing severe symptoms related to COVID. But all in all, keep staying alert. If you have not been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please reach out to us at 202-207-2480 and make an appointment. And if you're having trouble making an appointment with us, you can, and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. For Maryland residents, you can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. And if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with people who are around you. But you also want to be mindful of masks and keep your distance, especially when you don't know whether a person has been vaccinated or not.
And then a little on monkeypox or mpox as well. According to the CDC, there are more than 26,000 cases of mpox documented in the U.S. And in DC, you can pre-register for an mpox vaccine at dchealth.dc.gov/page/monkeypox. In Virginia and in Maryland, you can reach out to the local health departments for information on those vaccines and pre-registering to receive one. In DC, walk-up locations are now available from noon to 8 on Fridays or until supply lasts at the DC Health Monkeypox Vaccination Clinics. There's one in Ward 8 at 3640 Martin Luther King Jr. Avenue in Southeast, one in Ward 4 at 7530 Georgia Avenue Northwest, and one in Ward 2 at 1900 I Street Northwest. These vaccinations are on a first-come, first-served basis and eligible to residents who have not already received the first dose of the mpox vaccine. You're eligible to be vaccinated in DC if you are 1, a District of Columbia resident 18 years of age or older, and 2, all people of any sexual orientation or gender who have had multiple sexual partners in the past 2 weeks, including those currently considered highest risk, gay, bisexual, and other men who have sex with men, transgender men and women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs, such as bathhouses, saunas, and sex clubs. Proof of your residency is required prior to vaccination, and that could be an identification card with a DC address, a utility bill or other mail with your name and a DC address, or a current lease or mortgage with your name on it. So thank you for hanging in with us, and please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and checking the website, whitman-walker.org, for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker Health Services, please call us at 202-797-4439. Follow some of our programs in Whitman-Walker Health family at this page, Real Talk DC _ and at No Filter DC. Thank you all so much. Thank you so much, Jewel.
Thank you, Ayala. It's so good to share the space with you.
Thank you. Have a wonderful afternoon.
You too.
Bye.